we as women have such an amazing health journey, right? From starting with the puberty, we are getting the menstruation, and then, we give birth to the kids, and then later on, we move on to the other things like perimenopause and menopause. But in today's session, we are going to focus on the younger girls who have period problems. All right, so hang on for 1 second. I am going to have Dr. Lara, who's from Canada. And Dr. Laura is a fertility expert as well. And she takes care of women problem. Hi. Hello, Dr. Laura. How are
Hi,
you?
thanks for having me. How are you? I'm going to lower my chair so you can see my there.
Yes, absolutely. This I'm also going to go a
Yeah,
little bit like that so you
yeah.
my chin doesn't get cut off
It's
here.
off either here or here.
I know, I know. Well, thank you so much for being with us. To all the viewers, we are talking about women issues. We women have so many issues, but it's like, God made us and we have all these issues coming through our
Yeah.
thing. But today we are focusing on issues of menstruation, specifically for that and what causes the period problems. So we have Dr. Laura Pfeiffer. She is a naturopathic doctor from Canada. Maybe you can um, tell us a little bit about yourself, and then we'll go on the topic after that.
Yeah. So thanks for having me. As you mentioned, my name is Dr. Laura Pfeiffer. I'm a naturopathic doctor in Ontario, Canada. My main focus in my clinical practice is treating period problems and optimizing fertility. So this is why I'm here today. I also have created two programs. So I have a Passport online program, which helps women navigate through the specific stages of their period problems. And I have my Her of the Month membership program, which really helps women of all ages and stages build the foundations of hormonal balance.
Oh wow, that's amazing. So let's let's just talk about. I think a lot of women. I was reading a lot of research, although I'm not a doctor, but a lot of women, have started having issues with their menstruation as opposed to like 20 years back, right? Something like that. So, what causes these problems in women?
Yeah, so I mean, there are a lot of causes if we kind of let's piece them apart. So the first thing, we'll put them in like little bubbles and then go
Okay.
through each one. So the first reason why there are more period problems, I believe, is because we are the first. I'm gonna go ahead and say this is the first generation of women that has been on the birth control pill for this amount of time.
I see.
And so
Yes.
I'm seeing in my clinical practice on average, women are on the birth control pill for 10 plus years minimum. And so what happens is not that the birth control pill that we've seen so far actually causes these problems. It causes a lot of other problems. However, the birth control pill actually covers up whatever is going on. So I think it's a combination of like in utero exposures. We have more environmental toxins. We have a lot
Mm-hmm.
of stuff going on that does predispose us to hormonal issues. And I think the
Mm-hmm.
pill, we're introducing these excess hormones in addition to all of the other things that are going on. Um, and then we're really just covering up whatever might be going on, these imbalances. And then 10,
Yeah.
15 years in a row, we go off birth control. And now we're wondering why our periods are irregular and heavy and all of those things. And so I think that's part of it, that we're covering it up at an early age where we're supposed to be developing those, our body's supposed to be developing the skills of ovulation. And then we
Yeah.
just with birth control. And so because we haven't developed that skill,
Mm-hmm.
we're not ready to have that skill later on and we don't have regular periods. And so
Yeah.
another piece of that puzzle is women are having children later. And so
Mm-hmm.
having children later in life means we're probably on birth control for longer.
Mm-hmm.
Shutting that ovulation for longer, shutting off the communication between the brain and the ovary for longer. And so that's causing a lot of problems. But if we look at right now, if you're having regular periods, kind of what causes them, the first one I just mentioned is anovulation, not ovulating. Now, first of all, is to understand that you can actually get a period without ovulating. You can also ovulate without getting a period. So they aren't mutually exclusive.
I
What
see.
I often see is a condition known as polycystic ovarian syndrome, or PCOS, where women are having irregular periods. Now, you do not have to have irregular periods to have PCOS, but oftentimes we have problems with our periods because of that anovulation, that lack of healthy ovulation every single cycle. It is
Mhm.
normal to not ovulate every single cycle, but if we're not ovulating more than we are, then we have a problem. And so PCOS, there's a couple different causes. but the number one cause of PCOS is an imbalance in insulin regulation. And so that insulin regulation, dysregulation rather, causes us not to ovulate every single month. And so that's going to cause us to have irregular periods. Another that sorry, go ahead.
No. I'm just saying these are just very disturbing facts. Like, but the thing is, the funny thing is, you know, like my grandmother, she had 9 kids, so there was no concept of birth control at that time.
Yeah. No, it's just like you literally just get pregnant and you have a baby and you're breastfeeding and you're probably not ovulating while you're breastfeeding, and then you stop breastfeeding and get pregnant again. You have another baby. That's just how it was. And now women are not wanting to get pregnant. And so they're actively engaging in forms of birth control, which is fine. It is completely your choice and it is completely informed consent. My problem is that I think that with the birth control pill, with the hormones, a lot of people think if they're on an IUD, it's not birth control. It's birth control. It's all hormones. But I think that the problem is we're put on this without informed consent. We have a lack of informed consent. So we're not really understanding what we're doing. And I think a lot of women are under the impression that you're either on birth control or you're pregnant. And that's not the case, right? We can actively avoid pregnancy without being on birth control. Being on birth control doesn't allow us to actively really evaluate our menstrual cycle in a proper way. Like some women will tell me, oh no, my periods are regular. And then we get down to it and I find I'm on the pill. And I'm like, oh, okay, you actually don't have a period. Being on the pill, you do not have a period. You're having a withdrawal bleed. So I would imagine your withdrawal should be regular if you're taking hormones. Right? If they're not, then something's up. But really, we're not being able to evaluate that properly. And our menstrual cycles are vital signs. So without that information, we're losing so much information about our health in general.
So yeah, I mean, so what should women do? I mean, that's now okay. We know the problem. Most of the women, you know, all of us are working. We have careers, and we don't want to get pregnant. Like we obviously don't want to raise 9-10 babies now, or you know, we don't have the time nor the resources.
Sure, though, seriously.
I wish we did, but we don't. So now, what should we do as women?
For birth control, you're referring to?
Yeah, for birth control.
Yeah.
And then the naturopathy, you know, we go into how naturopathy can help with the period problems.
Yeah. So, I mean, for birth control, I typically recommend doing fertility awareness methods. Now, not a lot of people know. Now, there's 2 distinct forms. So there is the rhythm method and the fertility awareness method. The rhythm is basically where I close my eyes, I just put in my period tracker calendar, and then it tells me when I'm fertile, and that's it. And now that is a high failure. The reason why is because we're not looking at any signs and symptoms you're actually ovulating. So we're not really pinpointing that fertile window. What we're doing is we're assuming, we're using math, and we're saying, okay, your cycle day is 28 days. So day 14, you're ovulating. And that might not happen, right? Some women ovulate earlier, some women ovulate later, and sperm can live up to 5 days. And so if we're tacking on a couple of these days on either end of the fertile window and we don't know where it is, that's how it fails. But the fertility awareness method is really steps that walk you through looking at your body signs and symptoms, looking at cervical mucus, plus tracking your cycle, looking at your symptoms. You might be using temperature or saliva.
Yeah.
You might be using LH strips to really pinpoint that window. So I would actually recommend that. And then also there is non-hormonal IUDs, so like copper IUD or something you could speak to your healthcare provider about. Obviously we have our barrier methods, we have condoms, things like that. But I think the fertility awareness method has so many benefits beyond prevention and conception. We're really going to know what's going on with our body, and we're really get in tune to when something's not right.
Okay, that makes sense. So we're talking about the fertility awareness method. That's one of the options. Now, someone commented about, do you have any comments on DIM supplement?
Yeah, no, DIM is something I use all the time. DIM is the active component of what we would find in like Brussels sprouts, broccoli, cauliflower, that sort of thing. That's what food. I do have a comment on DIM. DIM is one of those things that helps really beautifully with moving our estrogen from harmful pathways to safer pathways. And so since you have elevated estrogen, or if I'm doing like a Dutch test and I'm running and I'm seeing that they have their estrogen moving to more of those harmful pathways causing DNA damage, oxidative stress, DIM will be part of my treatment plan. I do caution though, when you're taking DIM and you're deciding to take DIM, you need to understand what your root cause problem is, right? Because like I said, DIM moves estrogen. It doesn't increase progesterone. And so a lot of times we're assuming that our estrogen is too high and we're not really looking at our testing. So I would advise getting proper testing, because what can happen, especially when we give DIM for too long or to the wrong person, you can start signs and symptoms of too low of estrogen. So that throws us in a whole other imbalance. That's like symptoms of menopause, hot flashes, night sweats, that, because now our estrogen's too low. Our hormones do a dance, and we need to make sure they're in coordination with one another. And so I love DIM, part of a treatment plan that's therapeutic, that looks at the testing and really works on treating based on the root cause. And if the root cause is too high of estrogen, or estrogen that's going down the wrong pathway, DIM is probably part of my plan.
Wow, that's amazing. So what are the things from a naturopathy, as a naturopathy doctor, what are the things would you recommend on sort of on a framework? We talked about, fertility, we talked about DIM. What are the things, like, should women load up on certain type of diet? Like you talked about Brussels sprouts, cauliflower?
I would say there's things. I would say first in the framework is testing and diagnostics. So we need to rule in or rule out what's going on. I usually like to see a fasting insulin. If we have like a hormone panel, that'll tell us how we're processing our hormones. But if nothing else, I like to see blood work, progesterone, estrogen, and also we need to rule out a thyroid issue. A thyroid issue can be the problem for an irregular period as well. We can miss our period, we can have heavy periods. So getting a full thyroid panel is really important to that as well. I like to throw in a free testosterone, free, not total, so that we can actually see if our testosterone is elevated, and then we can see what sort of PCOS picture we may or may not have. As well, I add in things like LH and FSH if we're doing fertility. So that would be like getting the right testing. Once we have the testing, we can come up with a plan that makes sense. But from a dietary perspective, we're really looking at hormone healthy foods. Things like broccoli, Brussels sprouts, kale, cabbage is kind of where I would really start my foundations. Look at your plate, make it half full of veggies. We want to talk about proteins. We want to avoid, we know things like meats, trans fats, all increase the risk of fibroids and endometriosis. We know low vitamin D levels are correlated to fibroids and endometriosis. We know low vitamin D is correlated to painful periods, PMS. So vitamin D is something you would get tested as well to make sure you're getting the therapeutic dose, because vitamin D is fat soluble. Making sure we're focusing on healthy fats, fatty fish, chia seeds, hemp hearts, flax seeds, any of those omega-3s, we really because those are super anti-inflammatory. That's what I would say from a basic standpoint. And then everything else is going to be geared towards making sure it's supporting your body and your needs. So are you iron deficient? Are you thyroid imbalance? Then we might avoid soy, right? Is your gut an issue? Maybe you can't break down cauliflower Brussels sprouts because your microbiome in your gut is so off that you get below gassy with broccoli, cauliflower, Brussels sprouts. That's you, then we should probably go back a step, do some gut testing so that we can fix that problem before we dive into you eating this sort of diet.
Got it. So the first step is understanding our bodies, right? Testing. And then once you figure out the test, like you talk about the blood test, you talk about a lot of other tests like Dutch tests, saliva tests, so many things. And then once you understand what's going on, what's wrong with my body or anyone else's body, then you will kind of figure out the protocol. But on a high level, you talk about so many different vitamins that as women, we should not be deficient, right? Vitamin D, you talk about so many different things, right?
Absolutely. And I think that it's important to note that birth control also depletes a lot of these nutrients. And so understand you are continuing to stay on birth control, and that is your informed choice. That is completely fine, but we just need to understand the framework with which we're going to use strategic supplementation throughout that course of being control.
Okay, so then does the also exercise or anything else play a role in the menstruation? It's just the birth control and the diet and a lot of other things that we're ingesting. Do you think exercise?
Other reasons why we can lose a period is over exercising, under eating. We need to make sure you're clear of these 1,200 calorie diets. I see so many women that will come to my practice and say, I don't have a period. What do you eat? Well, I stick to under 1,200 calories a day. I'm like, whoever gave you that is not doesn't have sufficient knowledge in women's health, because this will mess up our thyroid, and our hormones cannot sustain this level of consumption. And so we need to make sure that we are nourishing our body in a way that promotes our hormonal health. We need to make sure we understand that fertility is last on our body bucket list. If we are not well, if we do not have enough calories or nutrition or anything else, our body's going to say, okay, what can we get rid of? We don't need hair, and we don't need to reproduce. So your hair is going to start falling out. Yeah. And your reproductive system is going to go haywire because your body feels like that is not important. We need our brain and our heart to continue to move. We need our kidneys to continue to function. What do we need to stay alive, right? And so if we are undernourishing ourselves, this is where we lose a period. I find a lot of times, a lot of women, especially with PCOS, will start on the keto diet. And when we're getting we are restricting those carbohydrates too much for too long, that's the problem. And this is when I recommend working with a healthcare provider who can help you get the right diet for you, because you could be under eating carbohydrates. We need to make sure that you're eating healthy carbohydrates and not limiting them too much, because we need to think about every macronutrient has a purpose.
So, but see, I mean, you're absolutely right. But, you know, a lot of us, like women, they go on the internet and, you know, there's like a whole flashing everywhere, 1,200 calorie diet, I'll make you look like, you know, Gwyneth Paltrow or whatever. You know what I'm saying?
Everybody wants to look like Gwyneth Paltrow. Let's be
I know, but what I'm saying is, you know how it is, like women want, so that's the problem. And I don't think most of the women understand what you're talking about, is the 1,200 calorie diet can actually start harming their bodies, right? And to your point.
Yeah, and we need to be careful about the impact on the thyroid and how it can impact your metabolism long term. A lot of times we see women who've been on yo-yo diet, right? They've been on this diet, that diet, and then at the end of it, it's like they can't lose weight. They're now postmenopausal and they have this stubborn weight loss they cannot lose because their body was so used to that Bernstein diet where they ate like, I don't know, 500 calories in a B12 shot. And it's not good for our body long term. We need to have sustainable dietary changes. We need to have progressive weight loss that is going to be maintained, right? And eating too little, I find that's one of my problems with MyFitnessPal is MyFitnessPal is a great tool for tracking everything, but I find when we also incorporate our exercise, I find that their targets are too low. You're either going to be in a state of where you don't lose weight at all because it's going to give you more calories for the exercise that you did, or it's going to put your target levels too low and you're going to just be eating too low overall, because it's not looking at you as an overall person. A lot of this research, we're looking at men, right? With fasting, with keto, we look at men, and women are not small men. We have very hormonal processes that happen that don't happen in men.
Okay, so now to summarize, by the way, this is an educational session. Please don't treat it as a medical advice. So we are just helping and laying a framework on a high level. So to summarize, what would be your 2 or 3 points that you would like to summarize with?
Yeah, I would say number 1, focus on balancing your blood sugar. Blood sugar balance is going to reward you long term. How to do that? I say look at fat, fiber, protein. Those are the things that throw on the brakes for blood sugar control. We want to slow down its absorption. So get rid of your refined bagel and butter. Get rid of bagel and cream cheese. Get some protein with that. Even a banana by itself, pair it with something that slow down absorption, especially first thing in the morning. So put on the brakes, balance your blood sugar. Number 2, focus on sleep. Sleep is going to be critical for your hormonal health. Try to sleep between 10 and 6. That is the optimal time for hormonal health. So those are the 2 things I would say to kind of start with. And then move your body in a way that feels good. Stop over exercising to try and lose weight. Move your body to use as an intentional thing to help your mental health and help your sleep. And also an interesting fact is when you move your body, your blood sugar no longer needs to depend on insulin to be stored. So a little bit of the stress off the body to store that blood sugar when you are moving your body. So move your body, sleep, and balance your blood sugar would be the top 3 things I would say you should start doing today.
Amazing. I think this is an amazing session to all the women, to all the people. I see people are joining now. You can, watch the replay after we are done. But we've been talking about issues with women's menstruation, and Dr. Laura just talked about few things that we should all do, right? And anything else you'd like to add before I wrap up?
The last thing I think I would add, there's so many pieces of the puzzle, but I think making
Yes.
sure you're getting the right diagnostic testing is the first thing, because I see so many women going through Dr. Google and finding answers in groups,
Yes.
chats, and saying, oh, I have PMS and I have raging periods and I have all these. What's one thing I can do? The best thing I can say is there's not one thing. That is the thing, right? There is nothing. It is a foundational approach. The one thing you can do, you'd be given birth control. And we all know that that's not helping. That's just symptom management, right? So I would say focus on getting someone that understands your concerns, that works with your concerns to get you to the bottom of what's going on, and then come up with a strategic plan for you.
Yeah, no, I think that makes sense. To all the women, I think we should stop experimenting, right? We all do that. We all go to doctor. Well, I mean, I'm guilty of that too. Just, let me find this out. Oh, I can do it by myself. And we try to self-administer the health issues, which can become very serious sometimes. So seek out help. That's the thing, and get to know your body by testing. So with that, I'd like to wrap up this session. Dr. Laura, amazing session. To all the women out there, please see this session, share these sessions, because this is such a valuable advice to all of you. Anything else? I'd like to wrap up right now, Dr. Laura, before I wrap up.
Thank you for having me. It's been a pleasure.
Absolutely. And thank you so much. And to everyone else, take care and have a great Monday. Bye-bye.
Bye.